can social protection and humanitarian assistance be more effective in countries affected by crises, including those driven by conflicts or climate shocks, or by global economic and political shocks? In this episode of Between the Lines, researchers and policymakers talk on how we can make social protection more inclusive in crisis settings. The panel include Rachel Slater from the BASIC programme, Nadine Khayat from the Beirut Urban Lab, Julie Wilson-McDowell from Save the Children, and Charlotte Barlow from UNICEF. Amongst the discussion, the panel suggests one thing policymakers and practitioners should keep doing, one thing they should stop doing, and one thing that they should start doing.
Hello, and welcome to this podcast on social protection in situations of protracted crises as part of the IDS podcast series Between the Lines. My name is Rachel Slater, and I'm part of a research programme called Better Assistance in Crises Research. We call ourselves BASIC Research short. BASIC is housed at IDS and does research that examines why, how, and when to use social protection approaches in different crisis contexts, so that we can deliver more effective social assistance and vulnerable people can cope better with crises and meet their basic needs. It's September 2025, and we're recording this podcast at the international conference being run by BASIC Research on social and humanitarian assistance in crises. Over the course of the 3 days, we're sharing and debating ways in which social protection and humanitarian assistance might be more effective in countries affected by crises, perhaps those driven by conflict or climate shocks or by global economic and political shocks. Today, we want to move on from a generic discussion about those issues and focus in on two things. We want to talk a bit more about a particular theme of BASIC research, and that's how, in these really difficult crisis settings, we can make social protection more inclusive. The second thing we want to focus on is how we talk about policy implications of BASIC research. We've got evidence about a lot of really interesting things, but we want to make sure that they're useful to policymakers and practitioners in those crisis-affected settings. We want to make sure our research is actually used. So, in today's podcast, we have a combination of BASIC researchers and some policymakers and practitioners. We're going to share some of our findings and recommendations with policymakers and practitioners, and we're going to ask them to reflect on those. Which things are doable? Which things are not doable or might be difficult? Why are they difficult? We want to ask, what are the entry points for doing social protection differently in these settings? And how can BASIC research help us get onto that pathway? For each theme, we've got BASIC researchers describing their policy recommendations in a particular way. Researchers are going to articulate their recommendations in a model that we call keep doing, stop doing, start doing. And as that suggests, for each theme, we're going to suggest one thing that we think policymakers and practitioners should keep doing, one thing that they should stop doing, and one thing that they should start doing. So let's start by introducing our researchers and our policymakers and practitioners. We're joined by Nadine Khayat, who's part of the BASIC research team. She's a senior lecturer at the School of Architecture and Design in Beirut and a research affiliate at the Beirut Urban Lab. Within BASIC research, she works on social protection in urban areas in Lebanon, exploring who gets access to social protection and who doesn't. And what she's doing most importantly is helping us understand better the experiences of IDPs and refugees, especially across a range of settings, camps, informal settlements, and within different urban communities. I'm the other researcher representing BASIC today, and I work on social protection and how it's sustained in fragile and conflict-affected settings. But in BASIC, I'm also tasked with making sure that we sustain a strong focus on gender, equity, and social inclusion throughout BASIC. We call this GESI for short. Nadine and I are going to share our keep doing, stop doing, start doing today with two really great guests. Our guests today are Charlotte Barlow from UNICEF, who is part of the multi-organisational community of practice called SPIAC-B. It seeks to help improve coordination in relation to social protection where it overlaps with humanitarian responses. Our other guest is Julie Lawson-McDowell, a senior social protection advisor at Save the Children, who works with a large range of other actors in the social protection humanitarian space, especially through the Brighter Consortium in Yemen. So we're excited to get some reflections on our keep doing, stop doing, start doing recommendations from people who would actually implement these ideas in practice. We're going to start with some ideas about what in BASIC we have called adverse inclusion. It's the idea that in many situations of crisis, accessing social protection can come with significant costs. Many people who receive social protection face a loss of dignity, feelings of shame when their photographs are published at distribution sites, or very public receipt of benefits, which can cause feelings of shame. So in relation to tackling adverse inclusion, our first recommendation, the things that we should keep doing, are keep building grievance and complaint systems to ensure that problems within social protection systems are tackled. It's something that lots of actors are doing, and we really commend that and want that to keep on happening. The second thing, the thing that we think international actors should stop doing, is delivering social protection in ways that don't respect dignity and privacy. For example, stop taking and publishing photographs of recipients of social and humanitarian assistance. We found loads of examples of this in BASIC research. Sometimes people are paying a financial cost to be in a program. Other times they're being shamed because they're in the program or exposed to repeated discrimination. And we think that's the thing that needs to stop happening. The third one, the thing that we think that international actors should start doing, is supporting civil society platforms that can enhance participation so that the specific needs and vulnerabilities of marginalised groups can be better addressed in programme design. If we can hear the voices better of people who need social protection but are marginalised, then we can design them better to include them. So I wonder if we can open this up to perhaps Charlotte first and ask, what's your reaction to the keep doing, stop doing, start doing around adverse inclusion?
Yeah, sure. And thanks, Rach. Thanks for the invitation also to this podcast. I can share a few reflections on these recommendations, maybe on the first one, on the grievances and complaints systems. I would say, first of all, totally agree. These need to be embedded in any program from the onset. And I think we've heard in different panels over today and yesterday that these need to be accessible from the very early, let's say, program cycle, right? Not only after beneficiaries or recipients have been registered, but even before, so that it's not only about complaining, whether a transfer has been received maybe late, but in the very first place when it's about registration. And I think maybe to answer to the question, where do we need more research? I think identifying exactly which type of registration, grievance mechanisms work. And I think for international organizations also, how much do they cost would be really beneficial, actually, so that they can really be included in program design. And then I just wanted to reflect also on the second point, which, to stop shaming beneficiaries, recipients. Definitely, that's actually something that at the Global Coalition to End Child Poverty, we also advocate for a lot. So we need to make programs more shame-proof. I think what is important here is also to understand that what might be shaming in one context might not be the same in another context, right? So understanding also, the context specificities of this would be really interesting.
If I can ask a follow-up to that, we haven't been explicit in our stop doing about how we make sure that that stops happening. But some of the ideas that we've come up with have been around having better rules and guidance on what can and cannot happen, for example, at a distribution, so that program providers have serious instructions about not taking photographs and so on. Are they the right sorts of things, or are we does there need to be something higher up to stop us having these kinds of effects? Are we suggesting the right sorts of activities?
I think, taking pictures is definitely one. But I remember actually in the panel earlier today, it was mentioned how pictures are often used also then to actually as a form of accountability, in the sense, look, these are the beneficiaries we're serving, especially by local organizations, and then in some cases they're posted on social media, which, of course, goes against all privacy regulations and so on. But often that's the only way local organizations can prove that they are delivering. So it's a mechanism also of social accountability. But definitely, in principle, I would agree. But
So there's a message back to us that we need to perhaps recognize some of the trade-offs. It's not just a simple thing to set a rule like that, and that we need to think about the broader ideas around accountability that are also serviced by those activities. I wonder if you want to join in at this point, Julie. We haven't quite got onto the start doing, which was support civil society platforms to enhance participation. I don't know, maybe you want to pick that one up, or perhaps come back to our keep or stop doings.
So just really quickly on the stop doing, one of the things around sort of degrading pictures, images that make their owners feel uncomfortable. I think there's some really great guidance out there now about how to present people, how to show them as agents in their own environment, how to show them not just as victims, as sort of miserable objects, but as real people. And it is, I have to say, it's one of the things that Save the Children does incredibly well. I'm old and cynical and very jaded, but even I can be sort of delighted and inspired by one of the stories that we tell. So I think what you need to start doing is to make sure you've got the guidance and the training, because there are ways to tell a story. And we want to keep linking people who are going through really hard times and who need support with an audience in the West that understands their situation, knows that they're not just taking handouts, but that they're going through real trauma, real events, and that they can be helped, but most of all, that they're helping themselves.
That's fantastic. I really like the way you've turned our stop doing into a much more constructive and positive start doing. I wonder if you have any reflections on that, the other start doing that we said about supporting civil society platforms so that the voices of either excluded or adversely included people come more to the fore in design processes.
Yeah, I'm going to be sort of one of those people I really get irritated by on podcasts who says, oh yes, well, my organization. But in this case, it's absolutely true that one element of Brightly in Yemen, and a really tricky one, is that they've created a fund which is for women's organizations. And the idea is that the women's organizations, they come up with a design, they participate, they themselves say what they want to do with this money, and then they get a grant. And I think that's a really strong idea. We're always talking about how we need to work more with women's groups, with marginalized groups, with people who are otherwise not part of sort of local decision-making authorities or informal groupings or more formal groupings. So I think having dedicated funding that can be sort of bid for at that very, very local level is not a bad idea.
And I think hearing that Save the Children and other international or indeed local NGOs are already doing this isn't a surprise to us. What's the challenges of getting bigger international donors or governments to support those civil society platforms? Because presumably that's a much more difficult thing to do.
Yeah. And Brightly, of course, is multi-organisational. And I think we've got good experiences across the different organisations. An experience I had elsewhere in northern Nigeria was that I think one of the big issues is not recognised how difficult it is in some contexts for civil society organisations to have a voice, to have a platform. Joining together with a group of other people and lobbying and learning and engaging with policymakers and civil servants, it's not cost-free. It takes a lot of time and energy. And quite often there are some basic skills to be learned, how to hold a meeting, how to use Excel spreadsheets, laptops. And I think we have such short time frames. We had a donor saying, well, we've been supporting them now for 6.5 years. We really feel we ought to be able to cut them loose. And I mean, the level of support was minuscule compared to the rest of the programme. It's like, no, keep going. At some point, they will be able to raise funds elsewhere. They'll become more independent. But just recognise the time frames. You've gone from zero, you've gone from nothing at all in this social protection platform to something that functions well, meets with decision makers, holds them accountable, meets with local communities. Recognise the challenge here.
Thanks so much, Julie. I'm going to hand over now to Nadine, who's going to talk a bit more about our keep doing, stop doing, start doing around displacement based on her work in Lebanon.
Thank you, Rach. It's lovely to be here. Thank you for the invite to be on this podcast. So in terms of protracted displacement in Lebanon, and this is the basic program that I've been working with. So in terms of keep doing, our research has shown that social assistance is fragmented and it's based on geographies. So it depends on where the person is actually living, whether it's in a camp, a formal camp, or an informal gathering, i.e. a camp that has spilled out, that is into an informal gathering, but not formally recognized as a camp, or an informal settlement, can affect the type of services that you can receive. And I'm talking about multiple nationalities here because if you are aware, Lebanon is a hotspot of its multicultural country, which means that we would have a very high density of Palestinians, Syrians, as well as poor Lebanese living in these different areas. So I think in terms of keep doing, humanitarian providers should be looking at providing diverse forms of social assistance, cash vouchers, in-kind transfers, public works, as well as free waivers and subsidies to all nationalities that are living in these different informal, in these different tenured lands, I would say, in a more equitable manner. I was wondering if you have any reflections on that.
Yeah, I think definitely I would agree. And I think it's super important also to understand the different barriers, right? That different groups of displaced populations face, which can be due to different languages, culture, religion, and so on. Maybe one thought I had just to add also is or pilots or experiences with integrating displaced populations that are often already part of the informal labor market in the host countries, right? Trying to integrate them into contributory schemes. And, there's been some experiences in Jordan, for example, because I think especially for displaced populations who've been in the host countries for many years, and they often contribute to the labor market, integrating them into contributory schemes is important also for social cohesion, right? In those contexts, and it's just fair because they do contribute to the labor market, so they should also have access to labor-related social protection.
So, yes, in principle, I absolutely agree, but I think we have to be very sensitive to the politics of a place, to the dynamic between a host community and a displaced community or a community that maybe is moving from displacement to residence. And we also have to be very aware of what's going to be acceptable to governments. It's not easy to have a one-size-fits-all rule. I know the case of Lebanon a little bit, and there's no doubt that the population of Lebanon has just been absolutely extraordinary in the way it's hosted the Syrian refugee population. But it's been a very, very hard time for Lebanon, and I think one has to find a balance between the interests of different groups, and it might not be the ideal solution because at the end of the day, we're often very strapped for resources. So, yeah.
Absolutely. I think the fragmented and unequal provisioning, especially in a context like Lebanon, could actually fuel perceptions of unfairness and and lead to inter-community tensions. So, which is one of the reasons why we are recommending to provide these diverse forms of assistance to everybody that is like perhaps living in a dense urban area all together in a hotspot, so that they don't perceive that different nationalities are receiving different types of assistance. So, in terms of start doing, our research has also shown that there are different that provisioning is not really that, although humanitarian organizations do provide different services, there are also a very important role for local actors who sometimes step in, especially in times of crisis. And sometimes it's only these local actors who are actually providing. So our research has shown that more coordination is perhaps needed with these local, sometimes they are informal actors. And I think that could present some issues with regards to humanitarian organizations regarding who they can work with on a local level and who they might not be able to work with at that level. So I was wondering if you have any thoughts about engaging with local informal actors.
Okay, I'll do the same as Julie. I'll cite our own work, which Julie actually has also contributed to. So as a SPIEGB working group on linking humanitarian assistance and social protection, we developed a set of common principles on exactly this topic, linking humanitarian assistance and social protection. And one of the principles is actually about localization and how to engage with local actors and how to include them in these coordination efforts, right? And and the tip sheets have a lot of great tips, as the name says, and examples also. But one of the things we say is that you need to map and understand the local actors in the context that you're engaging from the very start, and engage them also in the design of any response, and not only see them as deliver, which in many cases they are, right? Because they're key. They will stay in the location often after humanitarian actors leave, and they're key as intermediary also, which again I think we've heard so many times during this conference also.
So, yeah, I think Charlotte summed up very well our sort of collective viewpoint on how to engage with local actors. I think it probably also helps to try and make sure, particularly in a context like Lebanon, that you have a diversity of local actors. You know, you might find that some groups are very prominent, very vocal, but only represent a limited segment of society. So I think if you do a proper mapping, then you're going to be aware of the diversity and you can even reach out a bit. But at the same time, remember, this is going to cost you time and money, energy of your staff. So plan it, budget for it. Don't feel that it's something you can just add into the mix later on.
Absolutely. Engaging a broader spectrum, as Julie has said, of local organizations, while at the same time being sensitive to the social, political and dynamics of each community is absolutely imperative. And it's great to hear that this has been done in a tool that we can actually look at. So different nationalities are more are likely to receive different types of assistance. For example, a Palestinian living in a camp is more likely to receive UNRWA-supported health services, while a Lebanese living in an informal settlement is more likely to receive in-kind food assistance. So I was wondering, do you have any sort of recommendations regarding the different types of assistance that are provided to different nationalities, and how we could be more equitable in that?
Mm-hmm. I think it's a tough question, but I would say as a first step, just sharing this information, especially among humanitarian actors, is key. Again, this is also something that we as a SPIEGB working group advocate for, right? So that, different actors that provide support on the ground share the type of eligibility criteria that they use, so that we can see who's missing out, where can we complement each other, So I think that would be one of the first steps that I can think of.
So this is a tricky one, and it doesn't obviously apply in every context. But where it does apply, I think part of the problem lies higher up. It lies with the donors, it lies with the UN agencies, the big INGOs. They get money from particular pots to spend on particular groups of people for particular activities. And while they're still doing that, you're going to have this ridiculous parallel targeting with very unequal amounts or activities. Now, you do see it to some extent with cash plus programming, where it's maybe not nationality based, but we're trying to differentiate groups of people according to their capacity probably, and to give them different types of programming. And if you don't have proper messaging out there, and if you don't have really good explanations of why they might get different amounts of money for different, cash for work or cash for livelihoods or, behavior change cash, you're going to have a group of people who just don't understand and are probably quite disgruntled and think it's unfair. I would start with lobbying those above us, those with all the money.
Okay, so we're going to move on now to the third theme or area where we've got some messages about keep doing, stop doing, start doing. And that's around how we sustain social protection in crisis settings. How do we keep the existing programs going? And there in BASIC, we've zoomed in a lot on the social protection workforce and what happens to them, what they're able to do, and their role in contributing towards the sustaining of systems. Our first message, the keep doing bit, is not really about social workers or the social protection workforce. It's about some of the things that we're already doing. So the message is keep investing in building and sustaining capacities to deliver social protection. So our research in Iraq, Syria and Yemen has shown the importance of that shift from paper-based to digitized systems, the importance of being able to apply online for social protection and of digitized or electronic payment systems. The first one is keep investing in that. We recognize the importance of it. Before you react to that, the stop doing adds a bit more nuance to the keep doing. So the stop doing is stop focusing only on organizational level capacities, on things like MIS systems and digitization, and recalibrate, rebalance the ways that we invest to support the social workforce more. And our explanation is that it seems like at the moment we think we can tackle the problems that stop us from sustaining programs by making MIS more efficient. And in reality, what we found is really good social protection depends on those touch points, the face-to-face interactions between a human provider and recipients. And there are lots of elements of that that are not adequately resourced. My favourite example of it is staff in Iraq not having resources to travel to recipients. And then we get this perverse situation where people have their benefits cut off simply because the social workers need to see them, can't afford to get to them, and so have to find ways of making people come to the social workers. So that under-resourcing of social protection workers creates big costs for recipients. So I wonder if you'd like to react to the idea that we rebalance our investments in capacity and spend more time focusing on that social protection workforce and not just doing the system level MIS stuff.
I definitely agree. I think social workforce is key, and yeah, we've seen that in many countries. I think that the key, as you said, to reach the beneficiaries, to explain, and someone used it in another panel, to translate, and that might mean translate more technical language into a language that is understandable and help them to register for a program, for example. Yeah, I mean, I might be biased here, but UNICEF, I think, has been actually trying to invest quite a lot in capacities of social workers. So, for example, in Tunisia, in other cases, it has been paying actually the front workers of a social workforce. And I think that's an area that definitely is increasing also on UNICEF's agenda and recognized.
Julie, anything you want to add?
Well, I think your analysis, and honestly, we at Brightly have learnt so much from the basic work, particularly on Yemen, but more broadly as well. But I think the basic problem, is that we are only beginning to see social protection and social assistance and social insurance as being really part of government programming. We don't hesitate for a moment to support teachers and nurses and doctors and health facilities. But it's only over the last sort of 20, 30 years that social protection programming, that systematic programming to deal with inevitable life cycle vulnerability and chronic poverty and crises has really come into our minds. So yes, I agree. And we've seen, Yemen is, sometimes it's held up as, a great example of how external support has worked with government or quasi-government legacy programming, and it's kept it alive. I read critiques saying, oh, it really hasn't succeeded at all. And, it's like twins in the womb. One has survived at the expense of any other. There are lots of debates about it. But at least the attempt has been made. And I think we've seen some real results from that. But yes, we have to invest in the people who are going to do this job.
Thanks. I think I'll just move straight on to the start doing, which is really us trying to articulate. It's one thing to say stop just focusing on organisational capacities and think more about social workers, but it's another to say what we should do instead. And we've tried to articulate some of that. And Julie, you've already hinted at the logic behind this. We spent quite a lot of time reviewing HNOs, humanitarian needs overviews, published by OCHA. And if I use Syria as the example, we went through year by year looking at the number of times that those HNOs referred to teachers or referred to health workers. And they were consistently mentioned. It was consistently explained how many teachers had been lost because of the conflict, either because they'd been killed or because they'd fled overseas. The same for health workers. And we also measured how many times social workers get mentioned. And it probably won't surprise the two of you, but the answer is 0 for Syria. We get these occasional mentions of psychosocial workers, which really, when you look at the jobs they do, are mental health workers. But nothing else. And so our start doing, the most simple start doing that we think we can't understand why this can't happen. So perhaps if it can't, you can tell us. The most simple start doing is monitor what happens to social workers in complex situations, just like we do for health workers and teachers. And we can't understand why that doesn't happen. So maybe you can agree with us that it's a good idea, but try and help us understand why it doesn't seem to happen at the moment.
I don't have the answer, but I think one reason might be also that the social workforce as a category is very diverse, right? And again, depending on the context, they use different terms. It might be that health workers is maybe already a more established category of workers. And that it's maybe not in one of the matrices that are used for the HNO, for example, but I would definitely agree with the importance of monitoring, and especially, right now we hear every day about frontline workers who are literally getting killed, right? So would agree.
Julie, I wonder if I can nudge it along a bit into some of the things that you've just said. So, beyond that very simple start doing, there's also a start doing which takes it further, which is start paying social workers properly, start making sure that they're resourced to do their jobs. And that's making sure they have money for transportation to go and reach recipients and so on. And so we don't get those examples like the Iraq one that I just described. It's an easy thing for us to say, right? Start paying people properly. And, I look internationally at, there have been decades of international actors supporting public sector salaries in Cambodia, for example, post-crisis. What's stopping us, do you think, from doing that? You know, it's easy for me to say, pay them properly. Why aren't we doing it?
Well, I mean, it's not like we often pay teachers or nurses or doctors enough either. And it's not that we necessarily give them enough or their governments give them enough to do their jobs. You know, are there drugs on the shelf? Are there procedures in place? I think one of the tricky things with social workers is that they often don't have a one place that the customer comes to. You know, some of them do need, you know, it's a much more sort of outreach type of job in some locations. And the cost of transport might be paying for a new Land Rover and for fuel and for maintenance, you know, it depending on the context. Where governments have resources, and the you know, Syria and Iraq are probably countries which, if things go well, might well have resources. Yes, they should be including these social workers as civil servants and paying them in the same way. I think in more sort of difficult, fragile environments, and Yemen might be an example, you know, we maybe need to look at the way that international rules were applied. You know, one social protection organisation wasn't quite government, so could be funded and has grown and has expertise. The other one, trickier. It very much was government. The rules around our engagement as humanitarians, as development actors, said that we couldn't fund directly, and we went into this third-party monitoring sort of role. But maybe we need to start thinking about how, if we have to do that, let's tweak it. Let's try and retain staff. Let's try and employ staff. Let's look for workarounds so that we do keep the people with the skills and the knowledge in place.
Okay, thanks, Julie. That's our keep doing, stop doing, start doing elements that we wanted to share today. What we're going to do now is just finish by each of us talking through a very brief takeaway, what we've learned from the conversation we've had. So let's start with you, Nadine.
Thank you, Rach. So I think it's really important if I've learned anything in the basic conference the past day and these coming 2 days, as well as the podcast, is it's so important for us to keep discussing our research and to also look at the different viewpoints that are coming from practice and look at the research that is also in the work that is being done by different humanitarian organizations, so that we all work together towards a shared goal.
I think I'll jump in there because I had a very similar reflection. And beyond sharing our research, it's that we in BASIC need to take more time road testing our recommendations. I've learned things from our practitioners and policymakers today that I didn't know were happening, that I should know about before I dive in there and start saying what I think people should start doing. So my lesson is to talk to people more about the policy recommendations and not just publish them in a document. Can I ask our two guests what your takeaway is today?
Yeah, thank you. I think one of my key takeaways is, again, the importance of frontline workers or social workforce and really understanding the barriers that they struggle with every day, and really take those into account from the very onset when we start talking about program design, because I think we often keep it on a very technical level. We talk about the type of targeting mechanism, the transfer value, which are all very important, but we also need to talk about the humans who often sustain these kind of programs in conflict settings, right? And maybe the other point I just wanted to share again and invite all the listeners to have a look at the tip sheets that the SPIECB working group on linking humanitarian assistance and social protection developed. And thank you very much.
And I think my key takeaway is that this conference has yet again shown me that we're getting so much better at analysing and understanding situations. And we can use the same analytical frameworks in each context, but each context is different. And you said that, Rach, a couple of years ago. You said context, context, context. What's in place? What works? Who are the cross-cultural intermediaries? Who are the people in place? Organisations. And finally, think about your budget. What have you planned to do? Make sure you've got enough money to do it.
Thanks very much, everyone. We hope that everybody has found it illuminating to listen to the podcast today, and we hope that we've inspired you, if you're a researcher, to think a bit more about your keep doing, stop doing, start doing messages, because it seems to us that it's a good way for us to have a really constructive conversation between researchers, policymakers, and practitioners. Thank you.
Thanks for listening. Please like, subscribe, and share to help us spread the word. Do you have a feature that you would like to appear in a future episode? If so, then email betweenthelines@ids.ac.uk.